Everyone, greetings to all of you. PCOS is an imbalance of female sex hormones. The ovaries, along with the fallopian tubes, uterus and vagina compose your reproductive system. In the ovaries, they store your lifelong support of eggs that filled with fluid and they're covered with a follicle. This follicle and these eggs are your hormone producing system controlled by the pituitary gland of the base of your skull that are situated. In every month, this pituitary gland secretes LH and FSH hormones, that is follicular stimulating hormones, and LH hormones, that is luteinizing hormone. When the FSH hormone, the follicular stimulating hormone, reach to the ovaries, it starts to mature the hundreds of immature eggs. And when the eggs are grown in size, the follicle size also grows. So when the follicular stimulating hormones stimulate these eggs, the estrogen, the main sex hormone, is going to produce. When the estrogen level is coming to a certain level in your bloodstream, the LH hormone is produced by the pituitary gland, is secreted into the blood. This LH hormone causes the most matured follicle to release the egg. This process is called ovulation. When the ovulation process occurred, the free eggs is going to the fallopian tubes. Then gradually, if you meet a sperm, the fertilization process is occurred. If not, the unfertilized eggs and the underlying layers of the uterus and these vaginal tissues going down as your menstrual period. When you have a PCOD-like condition, this LH hormone level is imbalanced in your body. That leads to so many abnormalities, abnormal characteristics in your body. In PCOD condition, your pituitary gland secretes abnormal amount of LH hormones that disturb your normal cycle. As a result, your follicles do not mature and stay in the ovaries as water, like fluid-filled sacs that are called cysts. And your doctor also will identify you have abnormal amount of insulin level in your bloodstream. This LH hormone and this insulin hormone that increase your level of testosterone hormone level in your blood. As we all know that estrogen hormone is identical for women, this testosterone, male type of hormone, is going to start produced in your blood. So when this testosterone hormone goes levels up, the male type of characteristics come into practice. So hirsutism, dark colorness of neck and underarm region, and male type of baldness, and obesity, and subcutaneous fat layers in underarms and arms and abdominal region is going to appear. So the whole change of female version is going to be a male type of version. This is where we identify PCOD as physical features of what we can see in a PCOD patient. Not only the physical abnormalities, but also inside your body, a very risk to cardiac diseases and type 2 diabetes and increased cholesterol levels, and also metabolic syndrome like condition. And 50% of the PCOD patients are obese, and 8% of them have hirsutism, and badly 25% of them have infertility. So this is a very risk condition that we identify the main cause of endocrinopathy in the reproductive age of female. So we must care nicely and we must treat nicely this condition because it affects most effective age in women. Since PCOD was first identified in 1935, the last 2 decades, the quantity of the patients is dramatically increased. And the pinpoint treatment for this PCOD is really challenging for so many. There are so many medical systems, but the pinpoint treatment is really challenging. Here comes Ayurveda. In Ayurveda, we treat the root cause of PCOS, that is hormone imbalance in your body. I'm going to introduce my 4-step method, PCOS method for cure PCOD. P for practice every day. You have to practice your exercises, your yogic exercises and your breathing techniques. Just 15 minutes is enough. We have to practice these practices every day. If you wish to cure PCOS, you have to do physical exercises and a nice diet plan. If not, it's a dream. C. Cut down your calories. You have to burn your calories with the exercises and also your intake of foods. You have to cut down carbohydrates mostly. And with this diet plan, I'm going to introduce a very effective mealtime method and also the time you have to eat your meals. So watch my other videos, the next videos, then you will get more information. Next one, O. O for outfit management. The outlook of the PCOS patients, actually they are really suffering from the external characteristics that they appear as hirsutism, the discolorations of their skin and the subcutaneous fat deposits in the abdomen and the arms and legs. So these conditions have to be treated very carefully. And I'm going to introduce what are the methods, that harmless methods that you can follow to reduce these signs and symptoms. Yes, the last one, sleep pattern. Not only the sleep pattern, but also relaxation and the visualization of you in the society as a healthy individual. That is really important. As we all know that most of PCOS patients, they face some type of mental characteristic, that is depression and anxiety. So the balance of the sleep and the relaxation and also visualization, how they face to the society in a healthy way, that is really essential. So stay tuned and see you in the next video. Thank you for watching.